Hello, friends, subscribers, and visitors. Welcome to my site. My name is Dr. Gauri Bhede, and I'm a medical oncologist, which means that I'm the kind of doctor who specializes in treating patients diagnosed with cancer. When I was training and early in my career, if I met people socially and they asked what I did, I would say I'm an oncologist. That's the kind of doctor you never want to have to meet. Unfortunately, if you've been diagnosed with cancer or if someone close to you has been, they will be referred to a cancer specialist or an oncologist. There are mainly three kinds of oncology trained physicians. One is a surgeon who specializes in cancer surgery. The second is a medical oncologist who specializes in treating patients with chemotherapy or a vast variety and an increasing variety of new drugs, which can include targets against uh, specific receptors or mutations or hormones or antibody treatment. So that's the medical oncologist who takes care of the medicines that circulate through your whole body. And then the radiation oncologist who targets the tumor site with a very specific dose of radiation. The three specialists will work together to give you the best plan of treatment. It used to be that when you were diagnosed with a cancer, your primary doctor sent you to a surgeon and they took out the tumor and then referred you to a medical oncologist. And the medical oncologist then got together with the radiation oncologist and presented a plan of treatment if you needed one. Nowadays, we have discovered that altering this sequence of treatments or perhaps doing a different combination of treatments can have a better outcome. So you may end up having either radiation or chemotherapy or a combination of both before surgery rather than after surgery, and sometimes no surgery at all. So there's been a lot of progress over the past 30 years, and the sequence and the inclusion or exclusion of treatments has made uh, treatment of cancer a collaborative approach between all the specialties concerned. If you've been diagnosed with cancer, you've also discovered how long it takes for you to see the specialists. In fact, there was a study published by the Cleveland Clinic, a leading cancer center internationally, who tracked how long it took for their patients to go from diagnosis to actually starting treatment. And in their system, and in fact, across leading cancer centers across the United States, it took about 6 to 8 weeks to go from diagnosis to treatment. And this is not including the time in which you had something abnormal discovered on your scan and then had a biopsy. Then the biopsy takes about 2 weeks to get a result, and then you get to see the oncologist. So count your 6 to 8 weeks from that point onwards. And this is in major cancer centers, major university hospitals across the United States. If you're diagnosed in a smaller center, it takes that much longer. What goes through your mind for the 6 to 8 interminably long weeks that you are waiting to start your treatment? What's going to happen to me? What does this mean for my family? How long do I have? What are my treatment options? Who's going to pay for this? Will this bankrupt us? Do I need to go to another hospital? And there's really no recourse because you don't have the information at your hand to answer these questions. So, what happens? Nowadays, you go to the web. And in my experience, it actually makes it worse. I've had patients come in after waiting for all these weeks, although I try my best to get them in very quickly. uh, that they have printouts of information that is not related to the condition that they have, and they are completely misrepresenting or misunderstanding what they've been diagnosed with, and are in an even bigger fearful state and anxious state when they reach me. So we have a lot of things to undo when we start having our conversations. So, what is someone to do? Obviously, it makes sense to go do a search, but be mindful that you don't have all your information about your own condition to be able to interpret what you are reading. Also, be very careful when people come to you with their stories or stories about their friends as to what happened to them when they were diagnosed with this cancer and that cancer. This also is not relevant to your specific situation. So, what can you do to help you through that process? I've actually written a book called Diagnosis Cancer: What Happens Next? And it takes you step by step through the process of having the biopsy, planning your consultations, asking the right questions, and explains all the words that we use in the medical language in understandable words of the spoken language. So by the time you get to your oncologist and are ready to make a treatment plan, your brain is not in a fog, or at least in less of a fog, and you're able to have a meaningful conversation about your options and how they would benefit you and what the alternatives are. So, if you do get a chance and would need this information, please do pick up a copy. It's available on Amazon, and you can also ask your bookstore to order it for you. It's available in bookstores. After that, what can you do? Take a deep breath, uh, garnish your resources. Who do you have to help you? Go to your oncologist visit and listen to the conversation with you so that you can both understand what's going on and be able to ask the right questions. So, what else can you do while you're waiting for your consultations? You can take care of your general health as well as your mind, and you can start on a good nutrition and hydration program. You can definitely quit smoking. You can do some meditation to help calm your mind. It has had great beneficial effects on how your body has responded to the stress that is going through, and eventually decreasing your stress hormone levels will lead to a better cancer outcome. I also blog on my website, so do visit and join the conversation. The URL is www.gauribhidemd, that's all one word, GAURIBHIDEMD.com. And I tweet, and my Twitter handle is at GauriBhidemD. So please do avail of this information, and I wish you all the best on your journey.